Hello, my name is Dr. Mary Lyttles, and I'm a therapist with BCA Behavioral Health. I've worked with children and adults for many years, and one of the presenting issues that I typically see for my little ones are difficulties in regulating their emotions. During this pandemic, I've seen it more and more that kids are becoming flooded with positive and negative emotions, and they tend to struggle with making sense of what's going on inside. For example, when kids experience anxiety and worry, they tend to express this in somatic complaints, such as headaches and stomach aches, because they don't understand that they're nervous or anxious about something. Kids may be feeling anxious for multiple reasons, such as school concerns, spending adequate time with peers, and the fear of COVID-19. As mentioned, when children become anxious, they may exhibit this in a few different ways. They may act out in negative behaviors, such as aggression towards others, or turn their feelings inward, such as sadness, crying spells, isolating or withdrawing from others. In order to determine the severity level of your child's symptoms, start with a baseline. Is your child typically outgoing, or do they tend to stay in their room and play video games or read? Are they more introverted or extroverted? Symptoms of anxiety in children tend to look different for everyone, but typically I'd be assessing for some of the following: isolating from others, hyperactivity, difficulty with sleep, such as like falling asleep, staying asleep, increase in nightmares, irritability, tend to argue with others, and refusing to go to school. In children, they may also exhibit some of their anxious behaviors, such as skin picking, biting on their shirts, or regression, such as thumb sucking, bedwetting, or holding in their bowel movements. So parents, what can you do? One of the first things that I recommend for parents is to monitor their children's behaviors. Is the anxiety worse on weekdays, weekends, morning, evening, night? How often and for how long are the symptoms lasting? One way of completing this is having the child make a worry thermometer. At the top of the thermometer, have the child name the situations in which they feel the most anxious, and then you work your way down to the least anxiety-provoking situation. Have the child understand what their body feels like when they're minimally anxious, moderately anxious, and severely anxious. This is a good visual tool for children to help visualize what their worry feelings look like and how to monitor them throughout the day. Understand that it might be difficult to monitor your child's symptoms throughout the day, every day, and so what I do is I have some of the children take part of the activity with you. One of the activities I teach is zones of regulation. If you've ever seen the movie Inside Out, this is a pretty good example of how it's used. Red is usually associated with yelling, out of control, anger. Yellow is associated with frustrated, worried, or anxiety and silly. Blue is associated with sadness, tired, bored. And green is associated with happy, calm, relaxed. Have your child learn these colors and their meanings, and rather than asking them how they feel, ask them what color they may be experiencing. Then ask, how do you get to the green zone, which, as I mentioned, was calm. Now, my favorite technique to help cope with anxiety is deep breathing. Simple task, anyone could do it, and you could do it at any time of the day before you go to bed. First, you get into a comfortable position. You can either be laying down or sitting. Then you put your hands on your stomach and close your eyes. Take a deep breath in your nose and out your mouth. Again, if your hands are on your stomach, you can kind of feel how that the air coming in and out. Do this 3 times. Sometimes kids have a hard time remembering to do this, so do it with them. It's definitely something I recommend. Deep breathing is a really good way to ground yourself, return to the present, and in a sense, almost reset your brain. For example, a child becomes very anxious because Zoom kicked them out of their class again, and you notice the child wants to give up. Either help your child take 3 deep breaths at the moment, and then explain that their feelings are validated and the two of you guys can work it out together. Parents, I know you can't always be there if these breakdowns happen, One activity I like to do with kids in session is to make some artwork, writing down keywords such as breathe or slow down. They can color it, put stickers on it, put glitter, whatever. Then put the picture next to their desk, so it reminds them to let them look at it whenever they feel nervous or stuck. So to finish up my lesson on regulating children's emotions, remember that every child is different. Some of these techniques work, some of them might not, but try as many as you can. Use the child's strengths to help them understand and cope with the emotions, such as coloring or drawing the word stop and take a deep breath. If they don't like to write, have them draw pictures instead. One of the best solutions that I offer to parents is patience and consistency. Thank you.